Hi, welcome back to Hill and Ponton's VA Disability Blog. I'm Natalia Joffrey, our company COO.
And I'm Allison Reddick, one of the attorneys.
So today we're going to be talking about chronic pain and mental health claims.
Yes.
So this is something we see a lot of. Can you tell everyone basically like what chronic pain refers to?
Yes, because it's something that affects a lot of people, but it is difficult to deal with in the world of VA compensation. Although recently it has gotten a little bit easier. So let's say you have an injury, you hurt your ankle, you do some physical therapy, a few weeks later, it's better. That's acute pain. So acute pain, you have an injury, the pain goes away. Chronic pain is when something happens and that pain doesn't go away. It lasts for at least 3 to 6 months, but for most people, it never goes away.
Wow. And so does that then need to be documented in the veteran's medical records that this pain is simply not going away?
Yes, when I look through medical records, a lot of the times I'll see chronic back pain or chronic migraines. The word chronic is involved in a lot of diagnoses, but it's not necessarily needed.
Okay. And when we're talking about chronic pain, will you tell us, because normally like with back pain or with headaches, because so many of us have headaches in this office, you can have varying degrees of severity.
Yes.
And so does it need to be at the same intensity constantly in order to be considered chronic pain? Or can it be like today it's a dull aching pain in my back and tomorrow it's a piercing pain where I can't even bend? I mean, as long as it's continuous, can it be considered chronic pain?
Yes, as long as it's continuous. It's to the point where it's kind of a part of your daily living.
Yeah.
You wake up, your back is bothering you, or you wake up and you have that tinge of a headache. It's always kind of there, and you can do treatment, you can try acupuncture, chiropractic care, and it will help a little bit, but it still remains there. Chronic pain, what they think, they don't really know what causes it, but what they think is some kind of damage to the nerves. So something happened, let's say you had a surgery, something happened with the nerve where it's damaged, and now it's continuously firing and creating that pain.
What are some common complications that you see as a result of chronic pain or conditions caused by that ongoing chronic pain?
So I would say fatigue is a huge one.
Okay.
Along those lines, joint pain, insomnia, sleeplessness, and then our main focus, mood disorders. Some major ones would be depression. You're having this pain every day. You don't want to get out of bed because it hurts. You have no motivation to do anything. Going off of that, suicidal ideation. You're to the point where you can't get out of bed. You don't even know if life is worth living anymore. It doesn't have to be that you have an active plan. It could just be passive, like things would be easier if I weren't here. Things like that because of that pain, it's causing your mental instability.
And I can see how the lack of restorative sleep and fatigue go hand in hand, right? Because I can't sleep. Sometimes you have a migraine that's so bad you can't sleep because you lay down and even the pillow on your head hurts. And so you can't sleep. Well, so of course you're going to have fatigue.
Absolutely.
If you have days on end like this, or the same thing with chronic back pain, like people will tell us, I can't find a comfortable position when I'm sitting, when I'm standing, when I'm sleeping, so of course you're going to be tired.
And going with that would be anger, outbursts, things like that. You're in so much pain that the littlest things bother you. Another complication would be substance abuse. A lot of people self-medicate because no treatment is working. And so they'll abuse drugs or alcohol in order to help. I do want to specify, though, that not always is there a certain injury or something that happens. There are non-injury causes of chronic pain, which would be like chronic fatigue syndrome, fibromyalgia, irritable bowel syndrome, which are associated a lot with Gulf War veterans, endometriosis with women. There are chronic pain syndromes that are caused by injuries or cancer or things like that, but they're also non-injurious causes as well.
So using those 4 conditions as an example, do those have to have been diagnosed while you were in service?
No.
Okay.
A lot of the times with chronic pain, it takes time for the pain to develop to a point where you're noticing it. When you're in service, you're focused, you're in military mode, you kind of put it on the back burner, you're focusing on doing your job. Then you go into the workforce and kind of the same thing, you have a lot of distractions. It can get to a point where not until you're retired or you have less things to do that you start noticing this chronic pain, or it can be delayed onset and not develop until later on in life.
Just because I know that so many women suffer from endometriosis, how does that play into chronic pain and getting service connected?
So it depends. I know one scenario where endometriosis can be involved would be women who have cesarean sections in service. A complication of that could be endometriosis.
Okay.
I know that has a cause with it, but that chronic pain is caused by that C-section. Or let's say if they served in the Gulf War, exposure to the chemicals and the burn pits and fumes and things like that causes endometriosis. We don't know why or how, but that is one of the potential complications.
I did not know that. Okay. So good to know. Can you be service connected for chronic pain? That's the $1 million question, literally, right?
Yes. So that is what I was saying before. Prior to 2018, you could not. The VA did not acknowledge chronic pain because in order to get service connected, you have to have a diagnosable illness or condition. Well, in 2018, Saunders v. Wilkie, it was a federal circuit case. They finally decided that you can get service connected for chronic pain. It just has to be due to something that happened in service. So let's say you injured your back in service, but like I had a veteran who he operated tanks. And so the movement of the tanks affected his soft tissue in his back. But there was no diagnosis of that. You couldn't see arthritis, you couldn't see anything. But
herniated disc, something definitive, right?
But because of that continuous movement and that vibrations, it caused a deep tissue injury. So he has chronic pain because of that. So he was able to get service connected because he was able to show, I worked on these tanks. It was constant movement and vibrations. And we got a doctor to write an opinion on it to show how that causes deep tissue injuries.
Okay. Can you get service-connected benefits for secondary conditions?
Yes, and that's where the mood disorders come in. So same situation, you have a back injury and it leads to you developing depression. What you really need is just to have a doctor say, yes, because of his back condition, he's limited in his mobility. It has affected his mental health, and he has diagnosed depression. So that's the difference between the chronic pain and the secondary. The secondary, you have to have a diagnosed condition. So a doctor has had to have diagnosed you with depression.
Okay. Since you mentioned depression, we do have a lot of veterans, unfortunately, that suffer from depression as a result of the same suicidal ideation, a lot of substance abuse because, like you mentioned before, they're trying to self-medicate. We often talk about the importance of seeking treatment. If they need to get help, what should they do? Where should they go? Or what would be a starting point to try and get some help?
I would think a starting point would just be going to a primary care provider if you have access to that through the VA or through private providers. And that's a starting point. And they can refer you out to specialists if needed. In order to get service connected, you're most likely going to need a doctor's opinion to state that because of whatever happened to you in service, it's what's causing your current and consistent chronic pain.
But getting treatment is key.
Yes, getting treatment is always key. I know it's difficult because a lot of the times the treatment doesn't really do anything, but showing that documentation that you've tried injections, you've tried
medications.
You've tried chiropractic care. You've tried acupuncture. Just showing that this is something that isn't going away, and you've tried to seek treatment for it and get relief, but you haven't been able to because it's a chronic syndrome.
Yeah. Okay, great. Thank you, Allison.
Thank you.
Well, thanks for joining us. We will continue with more related topics, but in the meantime, if you have any questions, we hope you'll visit our website or call our office.
Thank you.